Okay, see here. So I am doing my presentation on focal nodular hyperplasia. So the equipment used was this GE machine. It's a little bit older, but it's the GE Logix S7 Expert Ultrasound machine, which is right here. And then I used a curved array probe GE C15D, which is right here. Okay, so a little bit of patient background and history. I'm going to use a pen. So this patient was a 26-year-old Caucasian female, and she came to get an ultrasound because she had abnormal liver number levels, which is fairly normal. A lot of people get ultrasounds for abnormal liver function tests or abnormal liver enzymes and all that. So, a little bit more background. The patient has been pregnant 2 times, only one live birth in 2016, so she only has one kid. Patient had no reported serious medical conditions. So, that is pretty important to remember. No serious medical conditions. And I remember her because she was heavily involved with an athletic lifestyle. She was talking about how she runs marathons. She doesn't drink alcohol. She is not a drug user, and she doesn't even really take ibuprofen. Like she takes that very rarely. So she, worked out, ate healthy. So she was a little bit confused and concerned as to why she had abnormal liver function levels, because she was wondering like what's going on because of her healthy lifestyle. She didn't know what could be causing abnormal findings in her liver. So here are the actual pictures of the focal nodular hyperplasia that I found. So you can see it's right here, and then right here. So you can see the liver is like a medium gray level, and then here you can see it kind of sticks out to you because this is very hypoechoic to the normal liver. So you can really see it right here. So that definitely caught my eye. And then right here is just another picture, and you can see it. Here's the normal liver, and then here's hypoechoic areas found in the liver. And this is in the posterior lobe of her right liver. So this is actually just right above her right kidney. So her right kidney would be right here, and then this was found right above her right kidney. So in the posterior lobe of the posterior right lobe of the liver, right here. And I'll take all my drawings off. So you can kind of see it stands out to you because this is very hypoechoic compared to the normal liver. Okay, so this is not actually from her ultrasound. These are just images that I found. I wanted to include this to show that focal nodular hyperplasia can look different on ultrasound. It doesn't have like very one specific look. So I just included this just to show y'all that it can look different. So this looks very hypoechoic to the normal liver. And then this looks very isoechoic to the normal liver, almost the same as the normal liver tissue. So this one might be a little bit harder to see, so a little bit easier to miss. And this is hypoechoic to the normal liver. And then you can see here that this one is very like hyperechoic to the normal liver, so that one might stand out a little bit more. So let me erase this. Okay. So this just shows that it can look very different on ultrasound, so you're not looking for one specific thing. So you can I just wanted to include that. Okay, so the sonographer's report for this right here, these are the actual pictures. We wrote up, so she did have renal stones, but I didn't include pictures of that because for this purpose of this presentation, because I'm focusing on focal nodular hyperplasia. But she did have renal stones. She had 2 in her right kidney. 3 millimeters was the bigger one, and then she just had 1 on the left, and it was 6 millimeters. But they were non-obstructing. They weren't causing any issues or anything like that. And then incidental finding of 3 anechoic lesions in the posterior right hepatic lobe. And the doctor said, he said there are 3 enhancing lesions in the posterior right hepatic lobe, most likely representing hepatic adenomas or focal nodular hyperplasia. Recommended further assessment with abdominal CT scan. So she went and got a CT scan, and spleen normal, pancreas normal, adrenals normal, kidneys, the stones, lymphatics normal, vasculature, appendix, no free air, no free fluid. And then liver, there are 3 enhancing lesions in the posterior right hepatic lobe, most likely representing hepatic adenomas or focal nodular hyperplasia. So he recommended further assessment with abdominal MRI. So she got a bunch of tests done. So I included what focal nodular hyperplasia might look like on a CT scan. So you can see here's the liver, and then here is the actual abnormality, focal nodular hyperplasia right here. And I remember learning last semester or second semester in 207 abdominal pathology that focal nodular hyperplasia sometimes has a central scar, and you can kind of see it right here on the CT. So it's a little bit easier to spot on a CT. So, and this one is in the right lobe as well. So I just included that to show y'all what it might look like possibly on a CT. All right, so results from the CT scan. I said that earlier, 3 enhancing lesions in posterior right lobe. It could be hepatic adenoma or focal nodular hyperplasia, and recommended further assessment with the MRI. So she did end up getting the MRI, and it showed focal nodular hyperplasia. And the patient changed birth controls, and the masses got smaller over time, which I think is pretty interesting. So that is what happened to her. So now I'm going to kind of go over and explain what focal nodular hyperplasia is. So it's a benign tumor that forms in the liver. And I kind of bolded the words that were a little bit more important, or more important points to focus on. So these tumors are not cancer. Focal nodular hyperplasia is more common in women, mostly between the ages of 20 and 50. Well, there we go. It's the second most common type of benign liver tumor. Cavernous hemangiomas are the most common. And focal nodular hyperplasia is thought to be the result of increased hepatocyte number. So that's, why she had abnormal liver tests. And it's caused by hypoperfusion or hyperperfusion from anomalous arteries within the hepatic lobule or lobe. So earlier in the presentation, when I said she had an active lifestyle and she was kind of concerned about why she had something wrong with her liver, because especially since she had no serious medical conditions, I thought this was interesting because focal nodular hyperplasia is rarely symptomatic, so you may have it and not even know, which happened in my patient's case that I scanned. And surgical intervention is almost never required. So if you just kind of change, like for example, my patient changed her birth control and the masses got smaller over time. So if you just kind of change what's going on in your life that possibly might be causing it, surgery is almost never required. So I think that was pretty interesting to pull these facts to the actual case that I did, or the person that I actually scanned. So a little bit more about it. Okay, so focal nodular hyperplasia is mainly found in females with association with the use of oral contraceptives, so birth control, So that was the case with my patient. She just changed her birth control, and it kind of made the masses smaller over time, and she was fine. So that was cool to kind of connect that back to my case. But I thought this was cool. An adult male, FNH, focal nodular hyperplasia, is often found in association with chronic abuse of alcohol. Sorry. Um, so that's just kind of the difference of what kind of causes it between males and females. And I just kind of added this. It is important to maintain a healthy lifestyle and diet in order to keep your body healthy. Um, just make sure to keep an active lifestyle and stuff to help reduce the risk of getting focal nodular hyperplasia. All right, and here are my sources, and that concludes my case presentation on focal nodular hyperplasia. And if anyone has any questions,